Hello and welcome. Doctors world over are fighting the dreaded coronavirus disease. The United States of America is particularly hit, as we now know, more than 1.4 million cases, more than 81,000 deaths. But one section of the medical community that's fighting this battle particularly hard are the Indian origin physicians in the United States. I'm pleased to now be joined by Dr. Suresh Reddy, who is now leading the American Association of Physicians of Indian Origin. Dr. Reddy is a neurointervention radiologist and based in Chicago. Thank you very much for joining us, Dr. Reddy.
Thank you, Govind. It's nice connecting with you this morning. Thank you.
Right. So tell us about the association and broadly, I know you have, close to 100,000 members, but take us through how many members you have, what are their predominant disciplines, where are they located in the United States mostly?
Yeah, so thank you, Govind. American Association of Physicians of Indian Origin, that's AAPI, was established almost 37 years ago. Initially, it was established to fight discrimination. And over the long time, we were able to fight successfully. And now you can see Indian physicians in top positions in the healthcare. And now the priorities have changed. Like we do not face that much discrimination. The discrimination has gone down significantly. So our priorities has changed to education, mentoring, research, charity, and service. And we represent the interests of almost 100,000. That's 1 lakh Indian physicians in the United States. That includes the first generation, second generation, and the third generation Indians. And we have 13,000 paid members in the organization.
Right, and what are the predominant disciplines? Like, for instance, you're a neurointervention radiologist.
Almost 30 to 40% are cardiologists. That's where most of the Indians are. Then the rest are, I think, maybe another 30% or 40% could be general practitioners, family practitioners, or internists, and the other specialties like surgical specialties, radiology like mine, and other specialties. But mostly, predominantly, are cardiologists.
Okay, that's interesting to note. And 1 in 7 American physicians are of Indian origin, as you said recently in an interview as well.
Right. So we are the largest ethnic medical organization and only second to American Medical Association. And we are almost 1 in 7th patient in the United States is seen by an Indian doctor. And more in rural areas because most of the Indian doctors settled down in the rural areas in the past.
Right. And what's the percentage of Indian doctors of Indian origin in the overall medical universe?
Almost around 10% or 10 to 15%.
Okay. Now tell us about the fight against COVID. So how are you seeing that? What are the roles that Indian doctors are playing, maybe differently or otherwise? What's your experience been in the last 6 weeks?
So this year, when I started, our goal was mostly we were fighting another disease. That's another deadly disease that's become global and viral. At that time when I took over in the last summer was obesity, because obesity has become has been established as a disease, and it's affecting children, seniors, and it's causing all kind of medical problems. It can affect any organ in the body. So that was our fight, and we wanted to make it aware in all the 7 continents in the world. And we did that. We did the South America and even Antarctica this year. And then after that, in the last few weeks, this COVID virus, when it first came, we thought it will come in China and maybe just dissipate, and it may not come as far as United States. But because of the traveling and the world has become so small, and as you know, New York is like a mini world. There is a citizen from every country in New York City. It rapidly came to New York, and it's playing havoc in the streets and holding us hostages in our own homes. And as you know, as we said before, because we are 1 in 7th or 1 in 8th doctor is an Indian doctor, so we are facing this war. We are at the forefronts, and overnight, these doctors are made to become soldiers at war front without proper training. That means we are never trained to become or work like a soldier. Our mental capacity is not to fight like a soldier, and we had to become soldiers overnight and put our own lives at risk and put our families' lives at risk, our kids, our parents' lives at risk, and go to war every single day. And because this came upon to us so suddenly, we were not even well prepared protection-wise or equipment-wise. That's how it changed suddenly the overnight. And but now we got a hold on it. We got the disease controlled a little bit, and we are on the downslope of the curve. And we do have enough equipment thanks to the government intervention. And suddenly, and we have the ventilators and all the equipment. And this is like a trishul, like a three-pronged attack. The government has an attack, the doctors do the fighting, and the lay public. So we took all the three positions. We sent letters to the government and the president, vice president, and all the state governors and the senators, congressmen that there should be a total lockdown. Universal masking is important. We were one of the first organizations to propose or put a press release for both of these. Then we opened up so many educational seminars for our own doctors who are in rural areas who are not exposed to as much in New York, and the doctors from New York shared with the rest of the country and all the world. And also the public education. We released several videos educating public how to be safe, how to be clean, how to wash their hands, how to wear masks. This was like a three-pronged attack.
Right, and tell us, the disease itself has progressed quite unusually, as in maybe the early symptoms were respiratory, but progressively, including in India, for instance, I'm talking to doctors here who are talking about gastrointestinal symptoms, other indications which were not there earlier. What is your experience so far, and particularly in the last few weeks?
In the beginning, it was only like three symptoms of fever, high fever, cough, and some sore throat, but later on, there are several symptoms were added. Recently, gastrointestinal, as you said, neurological symptoms. The main organ of attack is lung, but slowly it spread to other organs, and various organs have been involved, but still they are a little bit less, but the presentation is very varied. It's not clear. So like a little bit of fever, and if you feel that you don't feel yourself, I think you should go get a test done.
Right, and there are a lot of patients of Indian origin who also, lost their lives in the last 2 months.
Right.
Now, are you seeing the way symptoms are playing out amongst people in Indian origin? Is it different? Could it be different? I mean, for instance, people feel, or maybe not so much today because the cases are rising in India, but people felt that maybe Indians are not likely to be as hit because of either genealogical reasons or because of certain vaccines they've taken at birth and so on.
Those are great points, Govind, and I totally agree with you. Indians, in a way, or somehow have increased resistance to infections. Maybe growing up in India, where you are exposed to a lot of infections, you have more resistance. And also coming to United States, most of the people who are affected are African Americans and Hispanics. They are lower in the economic strata than Indians. Most of the Indians are well-to-do Indians, so they have huge houses, so social distancing is not a problem. They can most work in the computer field, so they can work from home. They don't have to earn their daily wages on it daily. So that way, Indians are protected in a sense. And also, there is no scientific data print, but I think there could be some, because you are exposed to diseases, you are exposed to several like malaria, TB, and all those, you are resistant. Maybe that's playing a role. But looking at the numbers wise, yes, Indians are a little bit more resistant, and the number of Indians who are affected are less. Most of the Indians who are affected are in the healthcare field. I know at least a few hundred doctors who got infected. Luckily, most of them recovered, but I know 2 who died, and another 3 close friends who are really still in critical position. So those are the ones who really got infected and got affected, are the ones who are serving at the front lines.
Right, and you said the doctors who got affected, were they cardiologists, or were they playing some other role, maybe on the critical care side?
Yes, they are critical care, and they are working closely with the patients. Especially some of them own nursing homes. Nursing homes are like old age homes in India, and they see these old patients. And one of my friends, 10 old age patients died in one day. So that kind of affected him. So there are whoever worked with the old patients, and they got affected closely.
Right, and your association has been doing a lot of work in India as well with clinics in many parts of the country. So tell us, I mean, in the context of coronavirus, do you see your association playing any specific role, or is it too early because you're still doing a lot of firefighting right there?
Right. The first, we are still fighting at the forefront here, but we would like to. As I said, we are three-prong attack. The one is with the medical education. So we are constantly organizing webinars with physicians from India, physicians from Australia, Europe. So we are constantly organizing these webinars, and at least we are doing 2 webinars every week. And so there is a lot of exchange of information because we are already hurt first, so we can give a little bit more information to the Indians. Coming to the government, we are trying to work with the government and help them, and also maybe donate some funds to the government. And education, and we have released so many press releases even in India, TV, media, for supporting Modi's and other chief ministers of lockdown. That is one thing that's saving India. With all the so much population and very little infrastructure in some of the sectors, still they are able to control this disease. That's the only reason is because the people
Right.
Collaborating and cooperating with the government and staying at home. That's saving
Right,
them.
and we are going to be emerging from the lockdown in small ways, but eventually, yes. And how do you see that? I mean, because the US is also grappling with this dilemma of emerging from the lockdown, and different states are going about it differently.
That is great, Govind. You got right on the point. These are struggling economies because American economy is a mostly the economy is. I'm not an economist, but I can say that unless it's keep in motion, it cannot survive. Whereas Indian economy is mostly rural based, and they can survive for extended period of time without it's affecting your daily life of living. So India is in a better position that way, and that's why they are able to stay locked down for extended period, and that's saving them.
Right. Okay. Looking ahead, Dr. Reddy, next maybe 8 weeks to 12 weeks, how do you see this panning out? I mean, I think the lockdown is going to lift one way or the other, I think in most parts of the world, because maybe we have no choice. How do you see it panning out? What are the challenges that you see
It's
yourself?
a little bit difficult, Govind, in the sense you are stuck in between where you want to take out the lockdown, but if you take out the lockdown, there's if you learn from the history, what history repeats, and if you learn anything from the history, if the pandemic, if it comes back, it hurts 5 times more, 5 to 10 times more. So you have to be very careful. Should not come back. So there's several. I think I just heard Modi he's doing an amazing job, and several of the chief ministers are doing amazing jobs. The way he's inspiring the people, and it's not easy with so much population. You have to open up. There is no way you can stop. But somehow this disease is affecting mostly the senior population. Maybe they can do in a phased manner where you can let the young people go and see how that works. But again, you have to be constantly on the watch. Every step, it's like walking on the eggshells. But you have to open up. You cannot just stay at home. But again,
Right.
there is a huge risk.
Right. And is your association, I mean, I'm sure you're going to stay geared up and stay driven for the next few months, but anything specific that I mean that you're doing or set to do in order to prepare for this long battle?
We are providing mostly. We are a non-profit organization, so we are providing mostly. We are focusing on education this year, global education. Try to teach, spread the education to various parts of the country, various parts of the world. That's one thing, and we're also doing some charity here locally because in the beginning there was some insufficient protective equipment, and so we donated some funds for equipment. And this week I had to mention this is a Nurses Week, Nurses International Week, and at the end of the day, the real war heroes are nurses, because doctors are doing, but the nurses are 24/7. They are with the patients. And so this year we are hoping to buy lunches for all the nurses. We already crossed almost pledge. We crossed 50 hospitals. We are pledging another 100 hospitals. We want to do as many hospitals as possible, buying lunches at least for one lunch to all the nurses to show our gratitude, how hard they have worked. And we are doing other charitable events here
Right.
and also in India, and our alumni
Right.
has supported local hospitals in India.
Right. That's wonderful to hear, Dr. Suresh Reddy. Thank you very much for joining us, and I wish you all the best in this long battle
And
ahead. Thank you very much for
I'm very
speaking to us once
confident that
again.
this is a dangerous virus, and we will beat this, and we'll have a wonderful Diwali, which will have a special meaning this year.
Yes, absolutely. I know I would have never thought about Diwali, but I'm glad you raised that, and let's look forward to that. Thank you very much.
Thank you, Govind. Thank you.